So this is the sit to stand exercise. We give this exercise to people for a whole variety of reasons. So we're just going to explain how to do the exercise correctly in this video. So it's really, really simple. All you do is, Will's going to demonstrate, you're going to sit your hips back to then come into the seated position and then return to a standing position. Now, it looks deceptively simple, but doing it correctly can be a challenge for some people. So what a lot of people who have back pain tend to do is do it with too upright a posture because they're afraid of shooting their hips back to sit down. So Will, could you demonstrate that for me? So yeah, exactly. So this would be someone who's a little bit too scared of bending forward because of their previous back issue. So this can help alleviate those fears for someone like that. So instead, what we want people to do is think hips back. You just sort of shoot your butt back in order to find the chair. So show us a good version now, Will. So as you can see, he's shooting the hips back and coming into a nice seated position. The other issue we tend to see a lot with people is often referred to as a valgus fault, which basically means one or both of the knees can cave in at some point during the movement. So Will, can you just demonstrate a valgus for us? So watch Will's knees. There you go. You see that right knee is coming in as he goes down and also comes back up. Show us that again, Will. So you can see that knee is caving in. So for most people, all we need to do to fix this is be cognizant of it. A lot of people who do this don't actually realize they're doing it. So all you have to do is simply, as you come down particularly, really think about keeping those knees out. So show us that, Will. Comes down into a squat with the knees nice and strong, pointing outwards. Now, I promise I'm not doing anything unseemly here, but I am going to remove my belt. So what we can do to help people with this is I often will tie my belt or a strap or something around the knees of the patient. So I'm just going to do that here. Will, I'm going to tie this belt around the knees. And what Will notice is that if he produces a valgus fault, the belt will fall. Whereas if he does the squat with knees out, like we want him to, the belt will remain. So it's not that the belt is providing a huge amount of resistance or tension, it's more a sign that the knees are either behaving or misbehaving. So show us the squat with good knee behavior, Will. Good. And as he comes up and down, the belt stays where it is. And then let's see. So Will, if you give us one with some knee valgus, let's see if the belt, yeah, there we go. And the belt falls, which means we know that the knees caved together. So that's a nice trick you can play at home to make sure that you're doing the exercise properly. That is the sit to stand exercise.